Swayam Prabha. Digital India. Educated India.
First aspect of AI, which is machine learning, and we looked at various things and how it can be applied to supply chain management. I'll keep moving. So the next one is called deep learning, which is a specialized subset of machine learning. This doesn't happen. So deep learning doesn't happen till you finish machine learning, right? From machine learning, if you want more data or self-generated data to continuously learn, or a particular aspect of learning, if you want to go even deeper, that's where the deep learning comes in. So it's a multi-layered neural networks. Don't be confused by those words. Those are all software terms. To model complex patterns involving, again, unstructured data. So deep learning becomes very useful when the data is not structured. What are those data? Mostly images that you get, or audio, text, sensor data, all these kind of data that you can collect, right? So in healthcare, image-based defect detection in drugs or devices. That's an area where deep learning comes in. Why is it deep? Because just because there is an anomaly in the data doesn't mean there's a defect. So in many cases, you got to probe more, which is where the deep learning comes in. Natural language processing, or NLP, for scanning free text logistics report, right? So logistics reports normally have two parts. If you look at any, one is the data on how many trucks came, what came in, and the boring data, I call it. But then the other part of it is people making comments. Delays happened at the border because of, and somebody writing down notes. Lack of this document led to something, somebody writing. Non-clarifying certain issues led to delays. So those type of comments that are written in a report, and how do you take them and how do they use it to whatever decision making you are trying to see. If you are trying to predict how long it's going to take to transit through a port, how long is it going to take to work through a system, things of that kind. So that's where this NLP, or natural language processing, becomes interesting. Sensor fusion in cold chain monitoring. So cold chain monitoring is very important that the sensors record the right type of temperatures, and so analyzing them and comparing them to temperature, humidity, and vibrations, and all those type of analyses is where it's happening. A startup called SigTuple here in India, and Niramai, people talked about that, thermal imaging, are early adopters of deep learning for specialized healthcare supply chain management challenges. So this is very in its infancy stage. The deep learning is not that much you see even in large scale systems, but it's a very important area that is evolving. Oh, stop it there if there are questions or comments. Okay, this one is used a lot, just like machine learning, predictive analytics, and it's very applicable to all the people here in the room who are going to be in the administrative side of things, hospital administration and things, because this is your business lens. It's application of statistical algorithms, machine learning, and business intelligence to forecast future outcomes. That's kind of where predictive analytics is. Typical predictive analytics tasks in healthcare supply chain management: forecast next quarter's demand on something, predict the probability of stock out that might happen in a rural warehouse, anticipate ICU admission rates. You talked about oxygen and oxygen supply chains affecting this. So these type of issues, we use traditional models, right? It's nothing new. These are not new problems, right? These are problems that have existed for a long time. And what normally people use statistical models for doing this. to predicting it. The machine learning aspect of it makes it a little bit more easier to incorporate, again, text-based data along with statistical data to do these kind of analyses. Why predictive analytics is central to supply chain management? Because managing uncertainty. That's a nice way to look at it. Predictive models allow proactive interventions. So that's a nice word to underline. Predictive models allow proactive interventions. If your predictive model were to say, for example, that you may have a stock out in a particular warehouse, you could be proactive in saying, how am I going to address that? Maybe you don't want to immediately jump and say, I'm going to increase the inventory. So instead, you could say, I'm going to pre-position some inventory in a closer warehouse. And if this were to happen, I can easily move it to them, so on and so forth. So managing the uncertainty meaning you do scenario planning. Questions? Predictive analytics. Yeah. Good point.
Which data, what?
And start thinking about uncertainty in your area. What makes you, if I knew that, it would help me, kind of. That's what the uncertainty is.
What?
Mike, please.
I have a doubt. Would disease modeling come under predictive analytics?
Oh, yes.
Okay.
We are not just.
I don't have any experience with that, but I think when in the health economic standpoint, when we do cost benefit and cost effective analysis, disease modeling really helps when it comes to whether a testing is needed or any intervention is needed. So then we'll be able to compare if there are any cost differences, time saving and things like that. So,
Give me a disease modeling example if you have one.
Okay.
Okay, so this is not really in the papers, but I have thought about it from my field. So neurodegenerative diseases like Alzheimer's, Parkinson's, the scans, MRI, CT, those are like the gold standard for diagnosing them. But I think that retinal imaging could be introduced as a primary screening tool. The thing is, it is a lot cheaper. So even patients who have differential diagnosis as Alzheimer's, Parkinson's wouldn't have to go through these expensive procedures if a retinal screening tool could be implemented. So I haven't done this yet, but I would really like to know through predictive analytics that what would be the cost difference, how much a patient will be able to save.
The only caution I would say is, being in the medical field, there should be a causality, and there should be a medical causality somebody has established. Assuming that is done, that is relationship between retinal kind of outcomes to collect them to Parkinson or other neurodegenerative kind of diseases, then this becomes a startup kind of a company.
Yeah.
A company that takes this and then looking at images and doing whatever you need to do. That's there. That's your natural language processing. That's your deep learning softwares. Those are there. It is collecting the right way. That has to happen. So you need data scientists working with medical professionals, working with health economists, coming together on something like that. I hope it happens for you.
Another example? Yes.
Sir, let's imagine I wanted to open another pharmacy in a new particular area. So, what kind of data I would require to predict the feature?
You have to tell me. You are going to open. If you didn't have any computer but you are going to open something, how will you do it?
So which kind of data I wanted to get? Like it's a kind of last 10 years data of that particular area, or okay. And diseases.
What data would you want to have?
So which kind of diseases is most common in that area?
Could be.
And population density, how their spending behavior, how much they are spending on medicine on particular area. It's a, whether it's a tier 1 or tier 2 or tier 3. If it's a tier 1, the spending power is very high. If it's a tier 2, the spending power is a little bit lesser than tier 1.
Good.
If it's a tier 3, we can't define, because nowadays the people who are living in tier 3, they want better treatment and good medicines.
Why not?
So which kind of okay.
What the specific factor? What?
Yeah, that's my question.
You have to think, you have to tell. So you are going to open a pharmacy.
The AI is not going to tell.
Yeah. Yeah.
Given those things, AI can predict, is this a good place to,
Okay.
Yeah.
right? So we have to do some work.
Yes, sir, definitely. We need to do some work. That's why, like, I'm understanding from here.
So when you are saying population density, do you really need any population, anyone, when you want to open pharmacy?
We need population. Like, as per my knowledge, like the current market scenario, like Apollo Pharmacy and MedPlus, they're opening each store for every 30,000 people.
Okay.
So Apollo have 6,000 stores across India right now.
Okay.
They are taking density. Yes,
So can I ask you a question?
yes, sir.
In a very rural area where there are 30,000 people,
No, sir.
I don't see an Apollo hospital.
Yeah, that's why the Apollo, not Apollo Hospital, sir. Apollo Pharmacy. Yeah. So Apollo pharmacies, they are mainly into tier 1 cities and tier 2 cities, not for tier 3 cities. So in tier 1 and tier 2,
That's okay. What they are doing, you want to open a pharmacy.
Yeah.
What unique factors for this industry you would look for?
data of particular.
Everyone needs data. Every
Yes.
sector. What specific data you would need? Anyone can help him?
Yeah.
Yeah. What kind of data? It's a good question. You want to open up a pharmacy, suppose. What factors would go into it? And for that factors, if you will identify factors, you will start gathering data.
Let me throw another variable into this. If there is let's look at tier 1 itself, okay? So let's say that's where you want to. There are Apollo pharmacies.
Yes.
Why do you want to open yours? What will be so unique about yours that will be more competitive than people going to an Apollo pharmacy?
Yeah, see, if Apollo is opening their pharmacies everywhere, but they are lacking in logistics, like they are not delivering medicines quick. So my unique proposition will be like delivering medicine less than 10 minutes compared to Apollo pharmacy. So for this to compete with big giants, I need some unique difference to survive in the market. So my unique difference is quick delivery for customers.
So do you have data on customer actually needing you to deliver to them?
Not a perfect data. I have few data points for customer need this thing, because the culture what after post COVID, we are getting everything in minutes. By sitting here, you can get your iPhone in 10 minutes. In India, it's happening. Okay, and
Don't deny any of those.
yeah. So
I want it. It's a different question.
Yeah. 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 Anybody from audience, just give some unique factors, for pharmacy, what factors you would? Age. And demographic. Above 50. Age can be one. Yes. See, now the whole class is helping you. Okay. To
When you
like,
become big, you may remember all these people.
yeah. So it's not population density, but age. Yeah. So what other point? Yes.
Ma'am, I would say that it depends on the doctors and the clinics around
good.
that.
Very good. This is unique, Other points are common. You want to open any facility, you want to know income. But we are talking about, here healthcare facility. This is very important. How many doctors are there? How many clinics are there? It's a general thing, we go to doctor prescribe, we would like to buy immediately closer to that. Okay. Yeah. So, any other factor?
Not much. I am not bothered about the 10. I want the cheaper.
Yeah, price.
Quality, best quality and the cheapest.
Price also better, right? So that is like, that income level will cover. So like, how much they want to afford, like that particular area they want to buy, what is affordability of that area, right? So this is actually very interesting, Professor. We did one analysis in fruits and vegetables, this thing. So everybody is aware of the South Indian chain Padamadir. It's the same chain, but the price of potato at same time of the day, there is a dynamic pricing there whole day, but at the same time of the day, the same chain will have different prices at different regions, depending on the income level and affordability of that particular region, that we have already tested. So same thing, that also matters. Okay.
But that's like, they also is the people who are covered like, it's a 0.45%.
What?
The people who are getting that
Oh, 0.45% is what?
population,
Population who is interested in quick commerce,
like they have that was spending power.
spending power.
They need to go outside.
Okay. Yeah. So laziness definitely a good factor for quick commerce. Point taken, Yeah, definitely. Yes. Right.
Yes, please.
In the previous slide, you mentioned forecast, predict, anticipate. That was that by design? Like we can just say predict.
Which one?
Previous slide.
This one or previous slide? He's picking my English, very bad.
Yeah. We should have a dictionary.
Yeah. Which one, my friend? Let me make sure.
They were down that.
Sir, I don't know. It's a silly question, maybe. But is there any reason why we are using this specific term? We could have just put predict next quarter, predict probability, predict ICU admission rate. Is it just a?
I think they are similar in their spirit of what they made.
What do you think is prediction?
Multiple.
But level like forecast we generally for mostly for 96 kind of people.
Repeatable.
For not that for that fix up site. What?
You're right. You would predict whether it's going to be raining tomorrow. You would forecast the weather for next few days. So,
Most of the original data.
What is that? No, but that
yeah,
yeah.
the time frame is probably a bit. All right. So the next one that I want to kind of inform you or talk to you about is typical healthcare supply chain management data types. So again, supply chain management. We are talking about supply chain management. So and I think it's a good one because we are getting into the data types. So a lot of transactional data, which is purchase orders, delivery receipts, inventory logs. These are as happening, people record them, right? Then we have time series data, that's data over time. So demand patterns over time, temperature logs over time. So time series data. Then you have more sensor data. That is, either GPS kind of data or sensors that are monitoring cold chains. Then you have clinical data, procedure volumes, diagnostic demand. When I say clinical data, I'm not talking about patient related clinical. It's all supply chain related clinical data. Then you have demographic data, population health indicators, regional disease outbreaks. Then you have this natural language processing, freeze text kind of a data, which is supplier reports, incident logs, maintenance reports, and things of that kind. So you see the richness of the data that comes through any type of, it could be handwritten kind of a data, it could be automatically gathered by Internet of Things device, or it could be past data that somebody has keyed into invoice or something like that. So that gives the richness for what we are talking about. And remember, these are happening every day, every minute. So the amount of data over time is a large. That's a necessity to think about an AI model. So lack of data, AI model is not a place to start off, at least. And the other reasons why AI ML are a good fit for healthcare supply chain management is, of course, you have lots and lots of stock keeping units. If you take a hospital as an example, hundreds and hundreds of items are there, different cost, different usage. So and you have a complex supplier network from whom you procure. We again bring in that uncertainty, sudden onslaught of diseases and sudden onslaught of disruptions, flood, some other delay, weather pattern. A supplier goes down because their factory has some issue. Anything can cause a disruption. And so that happens a lot. The nonlinear relationships, again, not easily captured by traditional linear models. The supplier, the ripple effect, as we said, that's a nonlinear relationship. Lack of a valve causing something else in some other department. Continuous learning, ability to adapt as situations evolve. That's an opportunity. These, as complex and as uncertain healthcare is, healthcare also repeats. You go through cycles of this repetition on a given day. So that's good. Anything that repeats, we have more way to learn to adapt. And so the key transition message here is, with this foundation, we'll now explore how AI/ML is practically being applied to specific healthcare supply chain globally, and how India presents both unique complexities and opportunities. So that's what we will do next. So the first place where you see from a supply chain standpoint where a lot of AI has started being used in healthcare supply chain management from a global context is demand forecasting. That we've talked a lot about that. I just want to bring it home. Why is this hard in healthcare? Seasonality, we've talked about that. Sudden spikes, we have talked about that. Human behavior, we've talked about it. Between the first and the second and the third wave, the hesitancy towards vaccination was different. Policy shifts also have impact. So all this creates interesting uncertainties, and so that is why demand forecasting becomes harder. If you are in a retail and you know exactly 0.45, you said with so authority that 0.45%, I don't need an AI for that if I know that point value so precisely. But if you tell me that I can give you that guarantee of that 0.45 only for 5 minutes, then becomes a very uncertain type of environment, because the consumer is changing so much. So the AI will use itself mostly the time series models, right? Those are some of the examples of those time series models. Some ensemble models, which is time series along with machine learning, is what we call as, and then some domain knowledge comes into that. Incorporate external variables such as social media today is a huge impact in a lot of these things. So one way that you're talking about an ensemble model is you have a time series model that looks at historical data, numbers, and saying, how do I predict? Then there is a social media impact of something that's happening that is going to cause the customer behaves at least temporarily differently. How do you model that into a forecasting model? It's not through a traditional statistical model. So that's an impact that is happening, right? Then anything with the mobility data, people's mobile devices are today are a way of producing the data. So that's what we mean by, incorporating some external variables, external to the normalcy of how we would normally do the analysis. So today the ML models are used in the Center for Disease Control in the US for flu forecasting. So they look at these kind of combining hospital reports, weather, and even Google search trends. They can use those things to forecast. United Nations, UK's National Health Services, they use ML models to predict elective surgery backlogs post-COVID, because after COVID, the amount of interaction people had in elective surgery has also changed. So that, how do you look at that backlogs and how do you predict it? Because that's an important one. So similar ML-based demand forecasting models were deployed. Gentleman here talked about the oxygen cylinder planning. I don't know how much of the ML went into what you did, but probably some forecasting. Can you talk more about that? Because you mentioned about oxygen cylinder planning. Mike, please, too.
During the COVID time, during the first wave, COVID came in a wave pattern. So during the first wave, we were more concerning about the people coming from outside and all the laborers coming out. At that time, the oxygen demand was very limited. Gradually, when hospitalization come up and the ventilator demand goes up, so gradually the oxygen demand increased. But hospitals were not prepared in that way. We are prepared like in normal condition. What we do, a B-type cylinder with a small cylinder, we do directly give it oxygen to a patient and the saturation returns. But in case of COVID, we have to use either a procedure called high flow method through ventilator or through normal ventilator procedures. So that needed either the jumbo cylinder or some other PSA plant like setup. So, and during the COVID time, the supplier who used to supply us the cylinder, they are very limited. And one supplier used to cater about 5 to 6 districts. And they have also their restriction of their labor and everything. So the supply also went down. The normal supply, what they used to do previously, that went down. So, and the cost means incurred per to and flow movement of the vehicle, that went up. So in that way, our department asks for the what are the how you are getting the oxygen cylinder, what are your demands, and what cost you are incurring. So we provided that data, and that data gradually it became in a portal form, and we did it on a regular basis, real time date. So after 3-4 months, what they came up with, our state government and the central government, they both combinedly make a decision that they will set up some PSA plant in the high load areas, and they also plan to develop some MGPS system, medical gas supply systems. So both of them are going simultaneously, and after setting up the PSA plant, the to and flow movement of the vehicle, the demand for the oxygen, which we was bringing from the other districts, that went down, and gradually the whole system our process got smoothened up. Very good.
Thank you. Anybody has any other examples? Demand forecasting.
I would add a point not related to demand forecasting, how machine learning AI is being used. So UNHRC, United Nations for Human Rights Commissions, so it has developed an app for refugee who are living in camp. They be from different ethnicity, different culture, different language, dialects. So on that app, on the mobile app, you can download it. As you speak, they are the different variables. They have trained the model based on your facial symmetry, color. As you speak in your language, it will identify which language you are speaking. So that they have trained it. As you speak, okay, like I am Hindi, I will say मुझे पानी चाहिए. So it will directly capture he's a native Hindi speaker and start conversing like you, and you can directly convey the message like what I want or what my problem is. So this is a very good initiative in humanitarian.
Good.
Yes, sir.
Fantastic. People are validating that these things are happening. Any other examples? Okay, let's keep moving. So second area is inventory management. Unfortunately, supply chain management is not as interesting as the examples you give. So we have to look at that. So again, the inventory management, always this word comes up, right? Either you overstock or you understock. So overstocking leads to wastages, understocking leads to shortages, and then you have expiry sensitive drugs, which are like insulin, vaccines, oncology drugs. Then a decentralized healthcare systems with varying levels of digital maturity. People talked about that, where you are in some of the digitalization kind of areas. So how can AI ML be of use in that type of setting or problem? Again, predictive replenishment algorithms will be helpful here. The ML models dynamically adjust safety stock levels based on consumption patterns, lead times, and external disruptions. So that's important one. This safety stock meaning above the normal level of inventory that you need to cover any uncertainty in demand. So the integration with Internet of Things and cold chain monitoring, temperature excursions detected early. So any temperature variations can also be detected and helped. So what are some of the examples? The Johns Hopkins Hospital in US, an AI optimized pharmacy inventory management reduced carrying costs by 20%, which means they did not overstock or understock. That helped. Walgreens, one of the kind of a pharmacy in the US, ML powered demand sensing for vaccines. So they were able to have the right type of amount of vaccines there. Who talked about even? Somebody talked about even, right? Oh, this is not the even. So electronic vaccine intelligence network uses real-time stock data, but still has limited predictive AI, a major opportunity space. Anybody has knowledge in this particular area? Something to pick up, which says a lot of opportunity in this space. Okay. Keep moving. Third area is logistics optimization problem. In healthcare, you need a lot of delivery, as somebody said as an example. Not only just delivery, dynamic deliveries. Things will shift. So you may have to change the schedules a lot. So because of the urban versus rural transportation constraints, right? Last mile deliveries and things. Then real-time disruptions. Remember the first day when we did the ripple effect, we said there's a truck that has to come on, but it was 2 states away and disturbed by a weather pattern. So there could be real-time disruptions, weather, strikes, traffic jams, all those type of things. So what is the use of AI ML use? There's something called dynamic vehicle routing, which is a very important part of research.